क्वेश्चन कि कम्युनिकेशन स्किल्स कैसे इम्प्रूव किए जाए।
It is more than important because अगर communication अच्छा होगा so handover process will be better.
Communication between the nurses, communication between nurses and doctors, communication with the patient, communication with the patient attendant.
From government to improve on communication, attitude, ethics. It is an important part which National Medical Commission is also integrating. Communication is the tool which helps you to bring trust between the two parties. It also makes them wise to understand what all things we are going in the process of treatment.
काफी लोग बहुत रेजिलिएंट होते हैं कि मैं कम्युनिकेशन क्यों करूं। नमस्कार दोस्तों, एक बार फिर से मैं आप सभी का स्वागत करूंगा हेल्थ केयर स्किल फाउंडेशन के पॉडकास्ट सीरीज में। जैसा कि अपन ने लास्ट पॉडकास्ट में डिस्कस किया था अबाउट हैंडओवर टेक्निक्स, हैंडओवर टूल्स, कैसे अपने हैंडओवर्स को इम्प्रूव किया जाए बेड साइड पे। लॉट ऑफ नर्सेज स्टार्टेड आस्किंग क्वेश्चन अबाउट इवन द बिगर क्वेश्चन कि कम्युनिकेशन स्किल्स कैसे इम्प्रूव किए जाए। एंड जस्ट टू गिव यू anecdote that my communication skills I have improved over the years from the many places, but when I started working with sir, that is the time when I learned a lot about difficult communications also. So that is the reason once again I am inviting Dr. Anil sir, our Healthcare Skills Foundation president and a senior faculty also, to give us some key points, give us some anecdotes, give us some skills, give us some easy ways to enhance our communication at the bedside. तो एक बार फिर से मैं सर आपका वेलकम करूंगा अपने पॉडकास्ट सीरीज में। What you as a lot of nurses were asking this question सर कि कम्युनिकेशन स्किल कैसे इम्प्रूव किए जाए, क्या किए जाए। पहली चीज तो मैं आपसे सर यही पूछना चाहूंगा कि कम्युनिकेशन इन इटसेल्फ एज ए स्किल क्यों इम्पोर्टेंट है हमारे हेल्थ केयर में।
I think first of all, welcome to Healthcare Skills Foundation.
Okay sir.
And since we are in that platform where we are outreaching a larger number of audience, especially nurses, doctors, healthcare workers, and जैसा आप पूछ रहे हो कि communication, why it is so important?
Yes sir.
And I personally feel it is more than important because treatment remains same at different places. There are guidelines.
जो हम हर जगह
फॉलो करते हैं। A patient of sepsis will take care of sepsis care bundle by the clinicians. An antibiotic, a fluid, a vasopressors, and plan and execution, evaluation. Everything remains the same. But how things changes is the interpretation by the family, is the interpretation by the patient himself. And how we deal with the family as well as among colleagues. So मुझे ऐसा लगता है, and this could be my personal experience, I feel communication is more than important, and it is a very very essential and a valuable tool to have better outcomes, better understanding, and better healthcare delivery. Because अगर communication अच्छा होगा, so handover process will be better. Clinician interaction will be better. Family and clinician interaction will be better. A family will share more information. There will be a better bonding. There will be better trust between the family, between the patient, between the caregiver, the nurse, the healthcare providers, administrators. A lot of places you communicate actually. No? A patient keeps on communicating at different platforms, but a good clinician can make life easy by making them understand the processes, what all things what a patient is suffering from, what is the way forward, and something like that. So I personally feel, and ऐसा भी मैं मानता हूँ कि although lot of emphasis is from government to improve on communication, attitude, ethics, it is an important part which National Medical Commission is also integrating in nursing curriculum, medical curriculum, education curriculum to improve on communication, because there is nothing called communication subject in our medical curriculum, although now various modules, AdCom modules, and a lot of things are coming up, which becomes an integral part of your orientation education.
All right, sir. So, sir, I mean, after, learning, even I'm being very thankful to you, especially in this part, that after working under you, training under you, I realized that my communication skill at the bedside has also improved. And eventually, I have understood one thing about communication is what जो मैं आपसे जानना भी चाहूँगा इसके बारे में कि कम्युनिकेशन कैसे करना है वो तो इम्पोर्टेंट है ही, बट उससे पहले ये समझना बहुत जरूरी है कि कम्युनिकेशन हमें करना है. Communication between the nurses, communication between nurses and doctors, communication with the patient, communication with the patient attendant, history निकालना, history को समझना. So how much the value of inputting time in communication, जो time का part है, काफी लोग बहुत resilient होते हैं कि मैं communication क्यों करूँ.
As already said, you can note down the history from files. You can note down the history from the family. If you note down the history from the family, it depends on your comfort. Family can still share much information which the other party or other assessment could have missed.
True.
Number one. Second thing, communication is the tool which helps you to bring trust between the two parties. It also makes them wise to understand what all things we are going in the process of treatment. Also, you are sharing the prognosis as well as outcomes. So trust, I think that is the most important part of it. And the respect multiplies. When you reciprocate, the respect also multiplies.
Right.
And communication is also between nurse to nurse. So that communication also takes along. A nurse communicating with patient, that communication also goes to the family. Sometimes you do hear, the nurse हमारे बात नहीं सुन रही थी. Yeah, there was an issue while feeding, bowel bladder complaints. So these are all communication which we keep on addressing. Family has a lot of things about nutrition, bowel bladder, and all those things. And whatever best tools we have, but I still feel communication holds a lot much importance. You have SBAR tool, IPAS tool, lot of tools, even lot of communication text is available, but nobody is teaching that text to your understanding. A nurse can actually communicate a lot of small things, a lot of good things to the family itself.
So just, to understand more, the one point which you have mentioned very rightly, sir, that there are challenges which patient also faces, and later on it highlights at the time of family meeting or something, and it becomes a big fuss. So the very first thing which I see is कि nurses directly coming to the doctors and communicating. So इसमें आप how much you will give the value to this कि nurses should also take a step forward and they should try to communicate more with the doctors, bring the challenges which they are facing at the bedside to the doctors, let them notice this thing too, so that later on.
So as we move on with the healthcare, the amount of empowering to nurses is also improving. Although a new subset, a new nurse, developing nurse, a trained nurse, there is a lot of manpower challenges as well.
True.
But a good nurse who is empowered and who is good enough to take care of critical care needs can actually be more precise, good at communication, good at raising the alerts, good at pointing out or highlight some problem
Challenges.
Just to take an example, if you have prescribed a patient ringer lactate or a potassium containing fluid or an extra supplemental of potassium, a nurse can simply talk to you, sir, this patient is already having potassium of 5.4. So why we are supplementing potassium? So that is how it should be. A patient having too much of gastric residual volume, a staff will also bring such critical alerts to you, so that you plan either a prokinetic or you decrease the amount of fluid or the feed, or a patient of fluid overload, not pouring out urine. You can restrict your fluid, you can plan a diuretic, something like that.
So we should also understand this thing. These all small talks are also very important towards the patient's perspective. तो डॉक्टर से ये सारी चीजें जो कम्युनिकेशन होनी चाहिए वो फॉर्मल मैनर में होनी चाहिए, प्रोफेशनल मैनर में होनी चाहिए, so that he also takes it into a serious way, just not in a very jolly way. This talk should be there कि सर इसका तो feed देने में ये problem आ रहा था, because eventually that feed, that moment is a very small thing maybe at that situation, but if it continues, that challenge continues with the patient, that can become a catastrophic event for the patient itself. So this professionality, how means nurses can improve the professional talks. Is there any tools? Is there any ways? Or they can make a chart summary and communicate with the doctors?
Chart summaries, all these things are already there. There are books, there are booklets, there are guidelines on communication, there are tools on communication. But they are there for last 10, 15, 20 years. But to get into the clinical context, to empower nurses with communication, it's a tough task. But believe me, you learn by seeing others performing. You learn by how other nurses are communicating, how doctors are communicating.
Very true, sir.
How we are communicating to them. So respect also multiplies. Understanding also multiplies. A staff could be weak at a language, but if you handhold or seniors can handhold, probably the same staff will be empowered to handle such needs, because sometimes I also feel language itself could be a barrier for understanding these developments. And we don't say you become too fancy with communication. I think you become too simple with communication.
True.
That is what a family wants. That is what a clinician or a treating team wants. That is what improves the satisfaction. A patient who can read a newspaper in ICU can simply coordinate a small discussion with a nurse. I need a specs to read that. So a small issue, it can create a big problem.
True.
A small newspaper can actually solve many problems. He will be involved, he will be engaged in that activity for which he has been already engaged for past 15, 20 years.
Yes.
So make life simple rather than getting complex.
Complicated.
So that is how we improve on such practices. If you start giving a meal which that patient is not comfortable with, so a nurse can take that small initiative of communication. कि सर आपको इसके अलावा और कोई चीज तो है. She can coordinate with a dietitian to change the meal. It solves so much of issues. The same issues will crop up after 2 days, 3 days. कि सर इनका तो feeding ही अच्छा नहीं हो पा रहा है because he doesn't like all this food what he has been not eating over last 20, 15 years, and he has been given such meals, so he doesn't like that. And आप hospital से भी allow नहीं करते हो. So there are small issues. Just to take an example, that is why I shared with you. And believe me, all these are already there in the issues. But I also see a lot of staff doing such small acts. They avoid sampling at some particular time in the night. Like let's assume 1 to 6 p.m. 1 a.m. to 6 a.m. They will not disturb a patient who is sleeping for sampling or X-ray or something like that. Because sound sleep also improves a lot of things for outcomes and patient understanding, family satisfaction, lot of things.
So basically, what sir has given is the final mantra is first is noticing the things and then talking about it and keeping it as simple as possible. That using those tools, using those.
So by simple, I also mean when I am interacting with family, my talk should not be too much of medical words. It should be simple
in a layman word. वो उनकी भी समझ में आ रहा है.
Understand. And sometimes the family is well educated. You can talk some medical terms. I don't mind. As well as family don't mind, because they are reading through Google. They are already versed. They are coming up with questions. So there are different set of families as well. So there are difficult families, there are educated families, there are uneducated families. And believe me, most of the time what we see violence, what we see challenges with communication, they crop up over a period of time. They don't jump at the time of admission. Their lack of communication, lack of understanding, that keeps up building over a period of time.
And you notice these things, I mean, there is a lot of things which is unsaid in communication, in medical perspective.
Obviously, also. Like once we interact with family, once we see there are challenges, sometimes there could be a diagnostic dilemma in the diagnosis per se. Sometimes you see there is a downfall of the event despite being aggressive with the medical management. Sometimes family do understand, but at the same time they are emotionally charged. So there is difficulty in understanding. There sometimes too much of family members also adds to the chaos.
So, sir, in this case, which you have just pointed out, like sometimes we see that even after explaining a lot, even after telling everything, they still don't understand the problem. They are difficult. So, sometimes we tag them as difficult families and how to handle this difficult family communication.
Actually, can hand over sometimes gives an information to this family is difficult to understand.
The tag which we give, and
so there are tags difficult to understand, difficulty in accepting the things. And believe me, they have not been born difficult.
True. Right. But the situation
is the situation which is making them difficult
because of various challenges.
A different personality. He could be different personality in this situation. He could not be able to accept the stress what is going through. And sometimes I personally feel small communication gaps over a period of time. If you see in ICU, a single patient is being approached through multidisciplinary approach. A nephrologist talk about just kidney approach. A pulmonologist talks about the lung parameters. A neurologist talks about the brain and the brain outcomes. Somebody talks about infection, somebody talks about that. So family also gets confused over a period of time. Somebody says he's improving with brain. The other doctor says he's having severe ARDS. The third one says the kidney functions are declining, urine output is down, there is need of dialysis. So how a family is going to interpret brain is improving, lung is deteriorating, you are needing dialysis. So we often complicate such scenarios. And end of the day, the solution lies again with good communication. We involve a multidisciplinary team meetings where we involve all the specialities taking care of the same patient. We bring them to a uniform page where we address, we document, and we make them understand. And probably it resolves not much of issues which are there. And at least family also accept it. But there could always be difficult families. True. And I think the situation, and you have to respect.
Even nurses can themselves highlight these things to their doctor's team also.
Obviously,
Sir, I have started noticing that family is not happy towards these things. So can we do something about it? Can we plan a multidisciplinary team meeting?
Obviously, that is called empowering of the nurses. A nurse is the best person to take care of such issues because a nurse spend more time what you spend taking care of a patient. She is the one who actually take care of all small needs and all big needs of a patient, as well as with the family. So मुझे तो ऐसा लगता है कि nurse should have the maximum capabilities, maximum understanding, maximum empowerment towards the clinical care.
And sir, जैसे ये empowerment word जो you have used it many times today about empowerment. So empowerment के बारे में जो जितना मैं समझ पाया हूँ, correct me if I'm wrong. Definitely empowerment by the ecosystem, empowerment by the doctors, empowerment by the team is also there. But nurses themselves should also accept this thing that they are very valuable part of the team. They should start speaking out.
So again, I think we have to take hold of them. We have to bring them as a team. We have to bring them the credit. What I personally feel.
This is what is our job, but they should also know that nursing is a very important part of healthcare, and they should also start speaking out. What I feel like.
मुझे तो ऐसा लगता है कि of whatever best results you see or what I have seen in critical care so far is something is called team dynamics.
True.
Something what a team performs. I'm not seeing a patient 24/7. You are also not seeing a patient 24/7. A nurse is also in that shift. But believe me that continuity of care
is what
team dynamics. What a nurse, what a team of doctors, a team of staff, management, everyone has a bigger role to play. So somebody says the patient has improved because of me. It's nothing like that. It's because of the team, it's because of the organization, it's because of the family involvement, patient support. So everyone has a bigger role to play. And somehow I also feel destiny also takes its own turn, provided we are in the right frame of mind, right context of event. And I again say on this platform, nurses are the backbone. They are the pillars of strength. They are the pillars of healthcare delivery, and they should be taken a step ahead in terms of recognition. And we should also give them recognition in various platforms about the care, what they have been doing. And if they are there, then we see results. If team is there, a group of nurses is there, a group of GDA is there, help is there, everyone has a bigger role to play.
So, I mean, I think so. Sir has highlighted many points into today's podcast, like keeping your communication simple, keeping it into the language which a family member is understanding, patient himself is understanding, listening to your patients, highlighting their problems directly to your team, to your doctors, to your other nurses, that you have faced this kind of challenge in your shift with towards this point of care of the patient, is also what is very important in improving the communication, because eventually, as what sir was saying, is the continuity of care is totally dependent of what are you going to communicate and what you are going to highlight into the next steps of your shift. So sir, yes, there, I mean, definitely, as you have highlighted, there are various tools. There are some tools which you know means one or two tools which you can highlight, which nurses itself can use also.
I really don't believe too much in tools, but I believe in actual learning.
And actually doing something on that tool.
Something you call it as experiential learning. And it could be a real-time simulation or real-time understanding. So as a doctor, we must involve your junior residents, your younger teams be a part of those communications where you are interacting with families. How good you are listening to them, how empathetic you are towards the care, how you are making them comfortable in terms of understanding. And it goes in a larger way. Same goes with the nurse. And if you start teaching by books, various tools and terminologies, probably the interest is lacking, and it will be like a presentation of book or a PPT.
Very true.
But I think it's something what you learn and gather over a period of time. I have improved over a period of time. We are still improving with our communication. We could also be difficult in terms of communication at times with difficult families. And that is how we are improving with each and every small
steps.
And even if somebody is finding it difficult, to try to solve that puzzle, why it is getting difficult. So your experience also helps. The various tools what you have seen. I share a small example with you. If I have a difficult family, I ask that family, should we start fighting or we find out a common ground? I give them a break of 10 minutes. I ask them to take a break of 10-15 minutes, point out what all questions comes to your mind which needs to be addressed by me. You make them sit in a comfortable room, offer them a glass of water, let them speak first, what all challenges they have faced, and try to solve each one by one. You cannot be solving each and every problem, but making them comfortable, making them understand the complexity of the problems. I think a lot of times you can solve the problems. You can actually decrease the intensity of problems. So again, I feel communication is an experience tool. You will improve on your communication as you grow up further in your clinical understanding. Your interaction with difficult families, your interaction with normal families. Because a nurse who is directly standing bedside is also requiring years of experience to improve on communication skills. Because
very good, sir.
Nobody teaching that experience of family interaction in their nursing curriculum. There is no simulation tool or a model where the family is there.
And the difficult families are there.
How the patient is not taking, why this is not being addressed. So that also is a matter of time. A staff who is 3 years, 5 years down the line will definitely improve on communication, provided his intent is right, his attitude is right towards patient care. So I think it's a matter of experience, your understanding, and seniors hand-holding.
Very true, sir. I mean, what you have just pointed out by experienced learning and all is what I have also noticed, that experience teaching, keeping them beside you while you are doing the difficult communications. Uh, Personally speaking, even I have, learned handling difficult families just by standing beside you and saying.
Just to add, actually, it's just sorry.
No, no problem.
Sometimes I feel we should be out of these lab values, out of these lot of complexities of medical terminologies, because family keeps on revolving around those numbers, like ventilator FiO2. You also know ventilator FiO2 number has got no significance, but family keeps on revolving
around those numbers,
about those values, about PCT, about TLC. So we have to talk what they understand. Don't give them another question to them which keeps on the same stuff, same challenges, and
keeps repeating the same cycle.
We have to be good at those skills as well. Nurse should also be empowered. Small issues that can be solved bedside. A family asking today's hemoglobin value, no doctor is required. She can immediately turn the page of the lab report and share, this is the report, and sharing reports is the right of family.
Yes, very right. I mean, this is what I was, trying to point out, that nurses should feel comfortable, that they should also come ahead and talk directly to the families, talk directly to the doctors, talk directly to the other teammates, that this is the challenge, or this is the thing, this is the information which you are looking forward to. And as sir has highlighted one very important point, which I also personally, I would say that I'm the example of that, is that I have learned more in communication by seeing my seniors, by seeing you at the bedside, that how difficult communications are to be delivered, how difficult situations, because in critical care, in emergency environment, it is a lot many times you are not, you are doing the best for the patient, but still you are not going to have the great outcome for the patient. And that is when you have to, be very upfront with the reality, but at the same time address the emotional part.
So that time also we have to understand, even if you lose a patient, we should be good at communication. Give them
the emotional part should not be missed.
Be taking care of all the needs. Sometimes I personally feel that you need a dress. That itself creates a lot of trouble at times, because family is not mentally prepared to get that dress. So sometimes I also feel dress can be given through hospital in case if there is not availability. Time delay, gaps, documentation, lot of things, in a diseased family or a diseased patient. So उस चीजों को भी हमें address करना चाहिए. We should be very empathetic. We should be understanding their needs, and we should also be cooperative enough to take care of such scenarios.
True, sir. I mean, to just finish our talk for today, the anecdotes which sir has given is keeping it simple, and most importantly, making it happen. Start talking to your doctors, start talking to families. Even in small steps, small information sharing will also help you learn that how to deliver it. And especially stand beside your doctors, stand beside your seniors, and listen to them, that how they are talking. Because frankly speaking, even you would learn all those tools, all those pointers which are written in the book, but when it comes actually at the bedside doing the difficult communications, you will forget all those tools. Your brain will become clean and white. You will not know that how to communicate those things. So this is, I would say that communication is more of in itself is an art which comes with years of experiences.
I think again, I just like to share with you, like you have a lot of restricted with visiting hours.
Yes, true, sir.
And the most difficult part is after visiting hour, everybody wants to visit the session.
Yes.
But that does not end over there. There are times when, first of all, you don't allow them, and after 2 hours, you realize you need them for some communication.
Yes. So then you are calling
them. So we have to understand and balance, and it's like they are here for medical treatment. They are not here for enjoyment.
Yes.
And the facility, the amount of stress, just standing outside the ICU and hoping somebody will call also adds to the stress.
So I mean, you can do better planning also in your
Obviously.
communication. हर छोटी चीज के लिए बुलाने से अच्छा है. If you are expecting कि
So
मुझे
if I expect a patient will require a consent for dialysis, he will require a consent for dialysis line. He will also require a consent for dialysis to be executed. So same thing can be taken at the same
the
go.
single sitting. Yes.
So we have to decrease the amount of disturbances.
Exactly.
And if you keep on asking for too many consents, too many involvement, so sometimes this is also very disturbing for a patient or a family member who is a caregiver to your father, mother, or XYZ. So we have to balance such communication as well. And believe me, a senior person should talk to all difficult patients, all sick patients. It should not be the junior most among the team who is interacting with a difficult patient or the sickest of the patient in your intensive care. I definitely ensure in my critical care practice, I cannot talk to each and every patient or a family, but I ensure these are these subset of patients which seniors must talk to the family to make them understand the problem.
I mean, I have seen that, sir. I mean, at the bedside also, that if the patient is critically ill and seniors are getting involved, the level of satisfaction, the level of understanding of that family member also improves. So this is our job as a nurses, as a doctors, that we should call our seniors to when we are facing these kind of challenges or when we are expecting these kind of challenges could come, which we can directly highlight it to our team. Like we sometimes do highlight to our sir directly that, sir, we might need your help in this particular set of patient for communication all because these kind of challenges are happening.
And all this communication is a part to be documented as well, because you see a lot of medical legal litigations are also cropping up in day-to-day scenario. There are a lot of litigations which also crop up. So these communication tools or the communication documentation in the words they understand will countersign this also becomes an integral part of care, because you never know, there are difficult families, there are difference in the family opinions. So बहुत सारी छोटी-छोटी चीजें हैं which we also feel consent is an essential part. Family communication, because after 5 days suddenly family says, sir हमें तो किसी ने कुछ बताया ही नहीं कि हमारा पेशेंट तो इतना sick था. And I'm very much surprised when a family says कि सर ये तो अपने पैर पे चल के आए थे, पता नहीं अस्पताल में ऐसा क्या हो गया. So that is how it starts cropping up.
Yes. So you should, I mean, definitely document every day also that what communication has been done, and even nurses also themselves, if they are making any communication, they can put up in their nurses notes and
communication like you shift a patient for a small procedure. Somehow it is not being done. Maybe that the patient is mobilizing to. There is too much of movement. The CT was not able to be performed. We simply speak to the family.
Yes.
There's a risk of sedation. You cannot give over sedation. Document in your nursing notes so that these litigation, these issues of family dissatisfaction, communication errors, or family not understanding the facts, because they understand that we are not capable enough to get the CT, but they don't understand the complexity of overdoses of medicines.
Yes.
So if you share with them, they will be more wise. You talk to them, sir, there is a risk of same patient getting on ventilator because of the CT scan. Is it that important? Or we can wait for some more time? Something like that,
Got it, sir. So I think so there were a lot of great learnings from this particular talk. I would request you to go ahead with our other talks as well. There will be more talks upcoming with some more senior doctors, more experienced doctors who are lined up.
Lined up in next.
We are trying our best. Sir is trying his best to bring more greater knowledge to you guys. We would request you to go through our podcast, go through our channel, subscribe to us, like our videos, comment on it. Whatever questions you have, please go ahead and put it into the comment section so that we can bring those knowledge to you.
So I think every nurse can also go across on the social platforms. There are a lot of videos about communication. There are a lot of videos about language picking up, how to handle difficult families. And since we are also in this podcast, we are also sharing to improve our communication skills, improve your understanding of the medical conditions. And somebody senior should handhold their juniors. Doctors should also handhold nurses to bring them to the same platform. That is what I feel. And books से ज़्यादा अच्छा है, learn with the experience, learns with your seniors, learns with your colleagues, learn during your handover communication, learn to respect, learn to earn, something like that, you know.
True, sir. Very true. I mean, learning at the bedside with precision, with empathy, with safety is always going to improve your care. So that's all for today. I would like to thank everybody for joining us for our podcast.